My initial injury was caused from hitting my wrist on a shelf in a store. I came to Dr. Peelman because I had seen several other surgeons prior who wanted to put pins in plates and cut my ulnar. That's not something that I felt was something that I should do at this time. When I first met Dr. Peelman, I called the office over the phone, and her nurse, Christine, was phenomenal. Knowing that I was in Maine, an hour away, she went above and beyond to make sure that I could get into the office, make sure all of my records were here, and that I was good to go when I came to meet Dr. Peelman. When I got here, Dr. Peelman just lit up the room. I could feel the hope coming from her. She looked at all of my x-rays and everything and just said, I think what we should do is a proximal rocarpectomy and a cast for about a month, and we should be good. I got a phone call saying that I had 3 dates to pick from surgery, and I picked that first week knowing that I had a mountain to climb to get prior authorizations and pre-op physicals and everything. But Christine went above and beyond and made sure that everything that I needed was at the doctor's prior to my arrival, made sure all of the forms were filled out correctly, and made sure that all of the hospital stuff was set up when I got there. The day of surgery was fantastic. I was so relaxed. I was kind of anxious about how I would feel after, but the nerve block was just, it ended up being my best friend. I had very minimal pain. When I came in for my 10-day follow-up, Ezra was blown away by my lack of swelling, pain, and bruising. I say that's due to the skill of the surgeon and wearing your compression bandages. Wear those. I had 2 goals going into occupational therapy. One was to hold a baby, which was met very quickly. And the second was to go back to yoga without any pain and making it through a full class. And I'm happy to report that I've been back to yoga. I've had to use yoga grips, but I went through an entire class, no breaks, no pain, no discomfort, bearing full body weight on my both hands at the same time. And just was so pleased with the outcome to be back at yoga, because that was my main goal. Dr. Peelman offered me a chance at a life that everybody said that I wasn't going to be able to achieve. I left her office and told everybody to check the security cameras because I stood outside dancing and crying because I didn't have to have my wrist fused, and I was going to start to live a normal life. If you're considering a surgeon for hand surgery or need a doctor to look at your current injury, I highly recommend Dr. Peelman. She will get you back on your feet and back to normal as soon as possible, and it's one of her top priorities. Her staff will make sure that you are well taken care of, and your main priority will be to heal and get back to life so that you can continue on and put this chapter behind you.